Now, is your dog possibly lagging behind, maybe not wanting to climb the steps or too tired to go for a walk? Many pet owners attribute these symptoms to aging, not pain. As part of our My Pet series, we have with us today Dr. Larry Baker, a general practitioner and boarded dentist, who is going to help us understand the signs and symptoms of a crippling condition called canine osteoarthritis. And also with us is pet owner Patricia Martino and her adorable dog Josie to share their story. Welcome to the show, both of you.
Thank you for having us.
I guess I should say all three of you. It's
all
very
right.
great to have you here too, Josie. Now tell me a little bit about your experience, Patricia. What Josie was doing, what was different. Look at her, she's kissing me.
She likes you.
I love her.
You know, Josie had slowed down and she was doing a lot of sleeping. She wouldn't go to the door to meet my grandchildren. She loves to play with my grandchildren. She wouldn't jump up on the couch. She just really wasn't herself at all. It was kind of sad.
Were you originally thinking that this was an aging thing?
I really did, because she's 11, so I did think she was just getting older.
Now, Dr. Baker, I'm sure you see a lot of pets come in, a lot of people talking about this. Is this a really common condition, osteoarthritis?
Yes, it is. And you know, we say that age is not a disease, and there are about 14 million dogs that have arthritis. Josie's just one of those.
14
and
million.
And about 10% are being treated. That's a very painful condition. I think people often do not recognize it at home because their dog is just, the signs are fairly subtle. Yeah. And veterinarians may not ask about the question because the owner may not think that's that important when actually the dog is suffering from some acute pain.
Now, when you started noticing things, Patricia, in Josie, did you end up looking for like a checklist or something to kind of point out what these symptoms might be?
I did. I went online and found a checklist, and I took it, and she exhibited a lot of the symptoms. So we went to the vets and we talked to him about it.
And then they said, okay, this is canine
That's
osteoarthritis.
what she has, right.
Now, I've heard about something, Dr. Baker, that's the Million Dog Search. Is that right? What is this? Tell me about
That's
it.
the best checklist online. It's sponsored by Novartis Animal Health and Hill's Pet Nutrition. And there's 5 questions on there. If you go online, or you can take this to your veterinary office too, and answer those questions, those companies will donate $1 to the pet charity of your choice from about 10 charities listed. And there are questions on there like, does your dog have trouble getting up in the morning, rising? Does he have trouble jumping up on the couch? Does he have trouble getting in the car? Is he lagging behind you on walks? And other questions which would indicate to us whether your dog might have the painful condition we call canine osteoarthritis.
Okay, so these are some of the questions that pet owners really need to think about. All right, we're actually going to talk about this. Dr. Baker will discuss the treatments available for your pet. You don't want to miss it. We're going to discuss this right after the break, so stay with us. Now, before the break, we were discussing some of the signs and symptoms of canine osteoarthritis, and we asked a few questions to see if your dog may be at risk. Well, we're back with Dr. Larry Baker to give us what your answers should be if your dog is healthy. And we also still have with us pet owner Patricia Martino to tell us about the progression of her dog, Josie. Thank you again for being with us and for staying with us through the commercial break.
Thank you.
Nice to be here.
Now, Dr. Baker, you just gave us some signs before the break, some questions that pet owners should ask themselves. What should the answer be if their dog is healthy?
The answer to all those questions should be no.
Okay.
So if your pet is having difficulty standing, climbing, going up and down off the couch, walking up and down stairs, lagging behind you when it's walking, there's an excellent chance that he has osteoarthritis. Very painful condition in dogs that needs to be treated.
What are some of the treatments for this?
You know, there are treatments such as chondroprotective. It's called chondroprotective injections. The ones that you buy over the counter do not work. The ones that are given by the veterinarian by injection are very effective, and they help really smooth the joint out. It's like making a new joint tissue.
Oh, okay.
There's pharmacy treatments. There's medication that can be given for pain. There's a dietary treatment that can be given for pain. There's exercise. There's weight loss. And the new treatment, basically, that's used in a lot of aspects of medicine is called multimodal therapy. That means instead of using just one treatment, we use more than one, and in a combination they work synergistically.
Now, what about for Josie here? Again, she is just so incredibly adorable. What was her prescribed routine, her regimen for helping with her pain?
She gets a pain med, and she gets an anti-inflammatory. Okay. I'm supposed to watch her weight, you know, keep her slim. Exercise, it's enough because she's great now.
She is great.
Oh, she really is.
And
it
she's
was a big improvement.
Still running around, able to be her normal self?
Oh, she does. She meets the grandkids at the door now, and she's always eager to go for a walk.
Now, there was nothing, Dr. Baker, you were saying there's nothing over the counter that people can do. Really, they need to go see their vet?
There's nothing over the counter that's helpful at all compared to what your veterinarian can give in the way of injections, pain medications, and diet.
Now, how difficult is it to get her to take any of the medication? It's chewable, so she's fine?
She loves it. She does love it. She thinks it's a treat.
So she never has a problem?
No, she's looking forward to it in the morning when I give it to her. Like she's waiting for me to go and get it.
Even with the injections, if they have to do it frequently, how are pets responding to that?
Very well. They're usually just they're with a very fine needle. Dogs don't mind them at all, and it's very helpful. I usually give a series of about 8 injections, and that may last for a long time.
Now tell us again some of the things that people should be looking for, just so that if pet owners they didn't see the first part of this segment, what they should look at.
They want to watch for difficulty in standing or climbing, difficulty in jumping up and down off the couch, maybe lagging in walks when you exercise them, take them for a walk. Any sign that may indicate there's just something wrong with your dog, it could be canine osteoarthritis.
Okay, and tell us again the Million Dog Search.
www.milliondogsearch.com. Excellent site, and $1 will be donated to a charity if you go there and take that challenge.
You take the challenge and $1 goes to a charity.
Yes.
That's great. Thank you so much, both of you, for being here. This has been incredibly informative.
My pleasure.
Thank you very much for having us.
And it was a pleasure to have you too, Josie. I'm just going to take you home with me. She's like, whatever. Now, for more information on canine osteoarthritis and how you can help your pet find some much-needed relief, visit www.milliondogsearch.com.